This video, entitled 3D Volume Imaging of Polypropylene Slings and Mesh in the Female Pelvic Floor, will demonstrate a superior technique for the imaging of synthetic implanted materials. The volumes and images in this video were obtained with an 8838 BK medical transducer. Its size and shape are similar to that of a traditional in-fire vaginal ultrasound transducer. Unlike the traditional vaginal probe, the 8838 is a high-resolution, side-fire, rotational transducer. The position of the patient during the scan is also similar to that of a traditional endovaginal sonogram. The patient should be scanned in the dorsal lithotomy position, and the transducer should be inserted approximately 6 centimeters into the vaginal canal. The system takes approximately 30 seconds to obtain and create a 3D volume that can be analyzed sagittally, axially, and coronally. Off-axis manipulation is also possible. The anechoic bladder can be seen in the left upper corner of the sagittal image. The shadow produced by the pubic bone is indicated with a red arrow. The area where the endovaginal transducer is located appears black on the image. Due to the close proximity of the high-frequency transducer, the urethra can be clearly seen just above the transducer. To analyze the volume axially, simply rotate the volume and use the trackpad to move the slice from inferior to superior. The urethra, transducer, and rectum will typically be seen midline posterior to the pubic bone. The urethra appears hyperechoic, the transducer inserted in the vagina appears anechoic, and the rectum appears heterogeneous and hypoechoic. Moving more superiorly, the anechoic bladder is visualized. Rotate the volume again to analyze the volume coronally. Mesh cannot be adequately imaged on X-ray, CT, or MRI. It can also be difficult, if not impossible, to identify with traditional ultrasound transducers even when scanning endovaginally. Normal mesh appears as an hyperechoic, wavy structure adjacent to the vaginal wall. The schematic on the left represents the sagittal image on the right. Normal anterior and posterior mesh can be seen adjacent to the vaginal wall, as indicated by the red arrows. In this volume, normal mesh can be seen again anteriorly and posteriorly by moving the volume slice from the patient's right side of the volume to the midline. This is indicated with red arrowheads. A midurethral sling and the shadow it produces can also be seen just inferior to the anterior mesh. To evaluate the mesh coronally, rotate the volume and use the trackpad to move the volume slice from anterior to posterior. This method can be used to evaluate both posterior and anterior mesh implants. Just posterior to the anechoic transducer and hypoechoic vaginal wall, the posterior mesh is indicated here with red arrows. Side-by-side coronal and sagittal images of normal anterior and posterior mesh implants are demonstrated here. Mesh contraction on ultrasound appears as a thick echogenic bunching of the mesh material. The schematic on the left represents the sagittal image on the right. Mesh contraction is indicated with red arrows. In this volume, you can follow the anterior mesh from the patient's right to the patient's left. Mesh is indicated with red arrowheads. A suburethral sling can also be seen just inferior to the anterior mesh. Notice how the mesh changes in size and thickness as we move through the volume from left to right and back again. The schematic on the left represents the sagittal image on the right. Mesh extrusion is indicated by the red arrows. In this volume, mesh extrusion can be clearly seen as the volume slice is moved from the patient's right to the patient's left. The extruding mesh is indicated by red arrowheads. Notice the mesh is directly adjacent to the transducer. The vaginal wall is no longer continuous. To image the extruding mesh axially, rotate the volume and move the slice superiorly. The extruding mesh can be seen here. Again, notice the mesh is located directly adjacent to the transducer. To image the extruding mesh coronally, rotate the volume and move the slice posteriorly. The extruding mesh will be visible just anterior to the posterior vaginal wall. The mesh can be seen here. The area can be enlarged for better visualization. Side-by-side coronal and sagittal images of posterior mesh extrusion are demonstrated here. Suburethral slings will generate the same echogenic signal with slightly more posterior shadowing as mesh. The shape of the sling will indicate the type of sling. Here, the schematic on the left represents the axial image of a TVT sling on the right. Side-by-side sagittal and axial images of a TVT sling are demonstrated here. The transobturator sling will generate more of an elongated seagull sign in the axial view. The schematic on the left represents the axial image of a TOT sling on the right. In this volume, two suburethral slings can be seen sagittally. Both are indicated with red arrowheads. Both generate the same echogenic signal and posterior shadowing. To image the slings axially, rotate the volume and use the trackpad to move the volume slice superiorly. The inferior sling will be the first to come into view. The image can be enlarged for better visualization. The sling is indicated with red arrowheads. Continue moving the volume slice superiorly to image the more superior sling, again indicated with red arrowheads. Moving the slice back inferiorly, a portion of the more inferior placed sling is visualized. In this volume, off-axis manipulation is required to better evaluate the transobturator sling. With limited amount of manipulation, a much larger proportion of the sling can be seen in one image. Again, this is indicated with red arrowheads. In this volume, multiple treatments for urinary incontinence can be seen. The inferior sling is flat in shape and located near the distal urethra. The more superior sling is curled. The sling can be seen folding over itself. A urethral bulking agent can also be seen at the proximal urethra and bladder neck. To image the implanted materials axially, rotate the volume and use the trackpad to move the volume slice superiorly. The first material to come into view will be the flat, more inferiorly placed sling. Notice no off-axis manipulation is necessary to image this sling. Move the volume slice even more superiorly and the more superiorly placed curled sling will come into view. Only slight off-axis manipulation is necessary to image this sling. With a curled sling, two echogenic signals will be seen in the axial view. Moving even more superiorly, the urethral bulking agent will come into view. In this volume, a sling can be seen at the proximal urethra just below the bladder neck. Here, the sling is located near the distal urethra. Urethral bulking agents can also be seen proximally. The last volume in this video demonstrates a sling within the urinary bladder. Here, in the sagittal image, the sling can be seen as an echogenic structure within the anechoic urinary bladder. To image axially, rotate the volume and move the volume slice superiorly until the bladder and the echogenic sling can be seen. Rotate the volume again to image coronally. Move the volume slice from anterior to posterior until the echogenic sling can be seen within the bladder. 3D volume imaging of polypropylene mesh and slings is a simple, convenient, and unrivaled technique that allows for better management and surgical planning.